This morning we've got the Ministry of Health, Wellness and the Environment on the inside. Two representatives here, Ms. Shanika John, Health Promotions Officer, and Mr. Elliott Samuel, Chief of Laboratory Services at the Milton Kittle Memorial Hospital. Before we took the break, we were talking about testing, things that you should know in terms of testing and quarantining. Some really, I'm going to stress some really important information. And I hope you guys have paid attention and will be better guided going forward as we try to fight COVID-19 in SVG. Now, as we left off, right, I said I had a question concerning the cause. So you go and get your PCR test done. Individuals are supposed to be called to give in their results. What happens if that doesn't happen?
This is a question that we've been getting quite a lot. So I would advise you to call the facility in which you got tested. And I know you're going to say you called already, and I would still advise you to
call like a million times
to call again. I mean, we've really been encouraging the teams to try their best to allocate some time to call and to respond to persons, especially for work purposes, because I know some persons would be out for quite an extended period of time and they have their job pressing them, what's happening, are you coming back to work, and it may impact their salary and so forth. Which brings me back to the point that if you're on quarantine, you should really ask the nurse to facilitate a sick leave for you. So if you're going to get tested as a contact of a positive, or the nurse may put you on quarantine, the team, let me not say nurse to make it specific, because it's a group of persons. So the team puts you under quarantine, you should ask, if it's not given to you, just remind them that you are working, and so you may need some evidence to take to your workplace, which should be in the form of sick leave. You will get a court order and so forth, but try to facilitate that process. So I would really encourage persons to keep calling. You could also send an email to the Coronavirus Task Force SVG, letting us know that you've been trying for several times to call your facility when you are tested, etc., and you're trying to get your results so that you could go back into your workplace, especially, and to see if there's any way that we could facilitate. I mean, it could just be as simple as we reaching out to the team leaders to say, hey, Crystal reached out and Crystal has been trying to get, this is Crystal's number. Can you facilitate this request for Crystal, please, so that we could have a smooth transition? I know there are some glitches. I'm not going to sit here and tell you it's a perfect smooth sailing. There are some glitches, but we're asking persons to continue to bear with us and work with us to sort of smooth over this process.
All right. As I mentioned, glitches, right? I'm going to go to this other question here. We've had complaints of some of the clinics refusing sending persons back who went there to try to get tested, and they're being told that, oh, we're not testing at this time. Come back on Monday, come back on Tuesday, or whenever. Are there special times to get tested at these clinics?
I think that was specific to when we were not having the flu clinics. So before the flu clinics, because that came into effect last week, Friday, there were persons that were going to different vaccination sites, regular clinics, and requesting testing. To avoid the sort of mix-up and mingling between those persons who are symptomatic, which means you're coming to get tested because you're experiencing symptoms, versus mommy who's just coming for her antenatal checkup, or a diabetic who's just coming for a refill for their prescription, we sort of separated and we sort of reintroduced our flu clinics. And that was part of the reason why people were getting specific time zones for their testing, because we were really trying to slow any sort of contamination, any sort of exposure to those persons who really didn't go to the clinics for any testing and, maybe exposed to somebody waiting to be tested. So now we have our flu clinics, and those flu clinics are actually open from 8 a.m. in the morning until 4 p.m. and it's no special time. You could go there and get tested at any time. We're also currently in discussions to move away those persons who are going for exit screenings from the flu clinic, and that information we will share in particular, because we're trying to accommodate persons as we go along. So I think that was, evident before the establishment of the flu clinic. We heard, and we, in our public health experience as well, we strategize accordingly. So I don't think persons should hear now that we're not testing at 9 o'clock and 10 o'clock, come back at 1 o'clock. If you are hearing that from a flu clinic, let us know so that we could look into the situation.
Okay, so how do we know which ones are the flu clinics?
So we posted a list last week in terms of our flu clinics. So for Kingston District, the Kingston Health Center is the flu clinic. And I think persons are been going there because you can see that the numbers were facilitating some other arrangements so that persons can be more comfortable and be a little bit more patient as well. So if we look at the Calico District, the Calico Health Center is the flu clinic. For the Cedars Health District, the Bible Health Center is the flu clinic. For the Mespo Health District, the Levi Latham Health Complex, that's the flu clinic. For the Georgetown Health District, the Georgetown Health Center is the flu clinic. For those persons who are over the river up that side, you can access care from the Overland Health Center. And I think even the health nursing supervisor and the FNP for that area, they're also going to strategize to see if they could do some mobile testing to ensure that persons have access to the services that are available. For the Pembroke District, you can go to the Layu Health Center, and that's where the flu clinic is. For the Chateaubelair Health District, the flu clinic is at the Tromoka Health Center. This was sent to our media houses. It's on our Facebook page as well, so we could reshare the information for persons. So within each district across St. Vincent and the Grenadines, there is a flu clinic.
Okay, awesome. Elliot, I think before we left, you had mentioned that you wanted to go in a little bit deeper in terms of testing. You can go ahead and do that now. I know you would have mentioned the antigen test, the PCR test. I can't remember specifically if you had mentioned how long it takes for you to get results from your PCR. Maybe you can go in a little bit deeper with the testing.
Okay, for where PCRs are concerned, we have two different PCR systems that we use on Ireland. And sometimes you would hear people referring to what is called a gene expert. A gene expert is only the technology, so it has taken on the name. And a lot of the healthcare professionals say I'm sending for a gene expert, but it's really a PCR test, which is a closed system PCR, and we can actually do it in a quick time. As opposed to conventional PCR that takes us 6 hours plus to get done, we can turn around a rapid PCR in about 50 minutes. We sort of use that. It's really concentrated in hospital, and we use it as our urgent modality. Like if we have people who are at AIA, Organ Isolation Facility, AIF, and we have people who need to have a PCR test done in a quick time. Those resources are on Ireland, and that system is up and running. It's pretty good. That we can turn around in a quick time. Then we have the traditional PCR, and traditional PCR is really it's a resource. And when I say resource, I'm talking about human resource and time laden procedure. It involves actually going into your sample and removing the RNA from the sample, and which is an extraction procedure, and then doing an amplification step so we can actually determine if the RNA is a perfect match to the COVID-19 genome. That procedure is a little bit more longer. That actually takes about 6 hours to do. And the way we do it, we actually run samples in batches. So you may find that you are doing a PCR test to travel, and we say you should get to the lab 3 days, including your travel day. And some people, I know a lot of people didn't come in today for tomorrow, and then they're down to the wire in terms of they're just hanging on for this result. And that is because, first thing, we don't run individual samples. So when we get crystal sample at 9 o'clock in the morning, we still have to wait until we get the batch of samples to process, because we have to load a 96 well plate to put on the machine. So that plate that extraction procedure may not get going until probably 2 hours in after we've received your sample. Then the extraction procedure itself takes time.
96 degrees in the shade.
And then the amplification procedure takes time. So you might find that a sample that comes in, that a sample that is taken at 9 o'clock in the morning may not be ready until, if it gets on a first run, until 7, 8 o'clock in the night. And that's just the time it takes for us to do a traditional PCR analysis. I want to clear the air on some confusion that has been going around, because I know people, when they present themselves to a healthcare facility to get a sample collected, in their mind, they are having a PCR test done at the facility. You're not having a PCR test done at the facility. You're having your sample collected at the facility to be submitted for a PCR analysis.
Oh,
so it's really a two-stage process. When you go to a doctor to have a test done, the doctor will give you a form, and that form is taken to the lab for the lab to collect the samples. In the instance, in the public health scenario, we don't deal with walk-in patients. The patients are dealt with by the community health program. And that's why we have it where you go to a community health facility to have your sample taken, and those samples are then transported into the lab to have the actual test done. So what you get done in the community, it's not a PCR test. You're having your sample collected to be sent for PCR analysis. It's not that you're getting a PCR test done in the community. And this has brought us to an important juncture. I mean, I know you haven't mentioned it as yet, but there seem to be some rumors going around that, you know, we don't have PCRs and we can't do PCR. And I think that is because people are
don't have files.
Right, they are equating the sample vials to a PCR. And that is one of the things we have to try to clear the air on, because I mean, if we are collecting the samples at one point and the samples are being transported in to have a PCR test done, while we may have some challenges with the sample collection vial, it doesn't translate that we are having challenges with the PCR test. And this is something that we need to clear for the public. Now, as it relates to resources to conduct a PCR test, there are several different resources that can limit your ability to do a test. So it's not just that it's like an oven, it's like a sample in result out kind of mechanism. You have to have things like your extraction kits, you have to have your enzymes, you have to have your probes and primers, your instruments have to be working correctly. So a simple thing, let's just, for example, look at Eppendorf tubes, which are one of the consumables that we use in the PCR reaction. If we're out of Eppendorf tubes, we may not be able to offer a PCR test, because every single piece of resources come in as a limiting resource when you are offering this test that have a lot of moving parts to it. Now, where we at now in this response to COVID-19, it's not unique to St. Vincent. I mean, we can see that a lot of the neighboring islands, Grenada, Barbados, St. Lucia, Dominica, I mean, all of them are going through exactly what we're going through now. It therefore means that everybody is out there trying to get resources, and the international community is still dealing with COVID-19. So it means a lot of persons are out there trying to get the same resources that we are trying to get.
Small island here trying to get to.
Right. So there are immense challenges as it relates to acquiring COVID-19 testing resources. I mean, some people might think that money is the only deciding factor, but it is not. You are sometimes in a position where you have ordered, you have paid, but you are still on a waiting list. And even when you have been given clearance that you're going to get the resources, there is also the issue of logistics. It's not easy to move resources from an international community into the Caribbean when you have a lot of disruptions in flight and the movement of goods and consumables across borders. So it's really a challenge. I mean, I don't want to say that at this time that we are not challenged by the resources we have for PCR, because I mean, we are running low on some items, but all of the moving parts in terms of acquiring stocks in countries is ongoing. I mean, the procurement process is ongoing. We have practically paid for everything. We are just now waiting to get stuff on island, and that is primarily the reason why we have actually adopted a strategy now where we are trying to conserve on resources that we have by limiting the amount of tests we do in certain points. And I think Shanika may get into that at some point.
No, I think that some point is no. Over the weekend, we've learned of, I think somebody has on a little batting there. Yeah. It has to come, all right? Over the weekend and this morning, I touched on it a little bit. Some persons were complaining that somebody's audio is up. So you want to turn it down? Yeah, Elliott, turn down the mic. Turn down. I mean, Mr. Samuel, you should know about these things, man. All right. So over the weekend, a couple flights came in, right? And some of the messages that we've received, and we've touched on it this morning, what we've learned was that if not all of the passengers, or most of the passengers were not tested for COVID-19, that PCR test. Is that a fact?
So before I answer that question, let's go back to our protocol, which I think you were reading from this morning as well.
Yes.
At the very end of the protocol, what does it do?
Well, the protocol long now. Well, let me go back to it. I mean, school this morning with Shanika.
The ending part, that footer part of it, of the protocol. And it says that you got it?
Let me go. Go on, you. I bring
It
that
says,
up, man.
please note that the protocol may be revised at any time at the discretion of the Health Services Subcommittee of the National Emergency Management COVID-19 Task Force, the Ministry of Health, Wellness, and the Environment.
So
So,
that's what happened.
so
Yeah, right down
specifically,
there.
so specifically this weekend, it's not that persons who arrived did not get tested. We did tested persons on arrival. However, from the Ministry of Health standpoint, we were actually testing a new strategy in light of all the increasing number of flights that were expected to arrive in October, November, Virgin Atlantic, CAL, etc., and so forth. So from our standpoint, we were actually doing a pilot, more or less, let's say that, to see in terms of how we're able to maneuver from persons who arrive at AIA, the testing procedure and the quarantine procedure. The methodology that we use for that is that, I don't know if you remember, or we could go way back from when we started, we would normally ask persons to await in their quarantine time. And that's even before we had high risk, very high risk, and so forth. Persons were asked to wait in quarantine period and allow us permission to clear the flight. And clearing the flight means that we're really doing that testing to see if there's possible anybody who would have tested positive. Were you 2 rows in front of that person who tested positive? Were you 3 rows next to that person? That sort of analogy that we were doing. I think the other thing that the public needs to remember and need to look specifically at our dashboard is that it wasn't until December 26th that we started to see our first local case of COVID-19 in St. Vincent and the Grenadines. So prior to that, imported cases accounted for 109. Then after that, it started to climb. We had that spike. From January to now, in terms of the imported number of cases, we have recorded 182. How many active cases do we have in St. Vincent right now, Crystal?
Plenty. Close to 1,000.
3,000 and some, actually.
Oh, so hold on, what? Wait, what are we talking about?
Active cases. Sorry, not active. Correct. You're correct. In terms of the number of cases that we've recorded in St. Vincent.
Check it out, banana.
I know.
Reported
In terms
cases.
of the number of cases that we've reported, overall total is 3,000 and some. When you minus that 182, we have 3,242 cases that we've recorded. In terms of our active cases in country, how many of those are imported?
I am watching it now, so tell me.
Very few, 1 or 2 cases that we have there imported. The point I'm trying to make is that for the passengers who are coming in on arrival and the testing on arrival has not given us a significant yield in terms of number of persons testing positive and so forth. So in terms of testing it out, and I know I'm very surprised because the Vincentian population in particular was very adamant that we should not be tested on arrival and that we should not.
But that was before. That was before. And you guys put your feet down and be like, listen, guys, this is what we need to do as a country, and so on and so on and so forth. But, I mean, as you mentioned that, did people know that the protocols or you guys were changing things at the airport? I think if persons had known, then they would not have requested. They would not have been, what is going on here? No testing. Oh my gosh, what is going on? But that was just like one of the issues.
The information was communicated. I mean, we did test persons, like I said. Persons were tested. Persons who are unvaccinated were tested. Persons who were on working quarantine for specific requirements were tested. So it's not that there was no testing, There was testing.
It just wasn't the testing for everybody coming in based on what was shared on Discover SVG, based on what was shared on SVG Health. You said that information was communicated, but who was it communicated to?
The passengers upon arrival. Because remember, we're doing.
Can't listen then.
Say that again.
They weren't listening then. Because how they complaining now?
To the passengers who are upon arrival, I mean, there was no mass messaging that said on Saturday, this is what we're going to be doing and this is how it's going to be done. Like I said before, it was an internal decision to just test this particular. And I mean, people have been complaining that they've been waiting 3-5 hours in the line, waiting to be screened, waiting to be tested, waiting to go through this process. And the only way that we could have really get a true assessment in terms of what's happening is if we run a pilot. And so we tested that methodology there, which really didn't sit too well with Vincentian.
Clearly not. Shanika, clearly not. It didn't. Because I would have received phone calls over the weekend of people panicking. I tell you, how you guys are gonna let people that are not test them for the thing. Next thing they come here, they don't even quarantine and they have the virus. And oh, you know how people are these days with COVID
But the
19.
other thing too, right? We had quite
Uh-huh.
a number of passengers who came with 24-hour PCR tests. When you come with a 24-hour PCR test, it makes and you are fully vaccinated and you're asked to quarantine for 48 hours. It makes no sense, and Elliot could explain that more, for us to
Mhm.
test you on arrival for that specific reason,
So I
because
just
you're
did
coming with a 24. And we have
oh,
people who come with
24.
less than 24 hours personally as well. But I think in terms of being able to be tested on arrival, so I mean, generally, our team would say because of your PCR test, we will not test you on arrival, but we will quarantine you for the time still because we're still clearing the flight. And so we had no positives from that particular flight or any flights from that reason, as far as I know. And I
But
mean,
not everybody get tested.
don't
So
quote me to it
so
to say.
we still don't know because not everybody get tested. Was that pilot was that pilot because of the shortage of supplies?
No, I don't think so. Elliot, are we short on supplies?
Elliot and say baptism, sir.
Well, I did mention a while ago that when you look at your procurement process, you get to what is called reordering levels. And when you get to reordering levels, you have to begin to look at how long it's going to take you to get supplies in country. Now, when we look at the circumstances now, we are not in business as usual mode. It's taken us twice as long to get resources. So we are actually at a point where we need to begin to conserve on resources. And that is why you
Okay.
will see us doing a lot more antigen tests, especially for our public health cases, and only bringing the positives to PCR as a confirmation strategy, because we really need to conserve on the buffer stock. Um, I don't think that's the reason why the protocol was changed, but because we have to actually look at, as I mentioned in my press conference, at some point in time, it's going to become materially difficult if we're going to sustain that high level of testing. And we are anticipating that the numbers are going to go up. Flights are going to be coming on stream. We have not yet hit that plateau mark for public health
Oh, they make me
experience.
want to
No,
cry this morning, boy,
that
Lord.
numbers are going to rise. So we have to be pragmatic in our approach to testing as well.
Okay, all right.
So we have
Don't
to look
stress
at
me out,
it this
please.
way, right? From
Uh-huh.
January to about, let's say, August or so, we've had thousands of passengers who have arrived in St. Vincent and the Grenadines. I'm sure it's probably clicking 10,000 or so. Could be more. I don't have the exact number. From those passengers who have arrived in St. Vincent via air and via sea, we've had, let's say, roughly about less than 100 of them testing positive on arrival in that retesting, versus we have calculated about 3,000 and some persons locally, which is in country, who we've actually detected that they've had the coronavirus. We have local delta. We have, so I think at this point, as Elliot has mentioned, given everything that's happening globally, the availability of the resources, our accessibility to the resources as well, we're going to have to come up with a different strategy. And that in itself was part of the reason why we were going to that. It's not that the protocol has changed, because we will issue an official release for our new protocol change. But just to know that the Ministry of Health were exploring options. And some of those options would imply that you may not be tested on arrival if you fall within a specific category. And that's simply because in public health, if we're getting low yields from it and we're investing so heavily in it in return, let's not talk about people. I mean, I have people generally who ask me, so I just paid $400 and something in Grenada for a PCR test. What's the cost of the PCR test when I arrive in St. Vincent and the Grenadines? And the government and the ministry, we've observed that cost for passengers who arrive. And there are other alternatives that we could definitely look into, and people can have discussions about that. But I think at this time, we really need to focus a lot of our attention, which is what we've been doing, our flu clinics, our vaccination drives, our testing drives in country, to sort of reduce the spread and to contain the virus locally.
All right. So at this time, we're going to welcome the questions from listeners. All right. Quite a few. Somebody says, I'm fully vaccinated with Sputnik V, but I realize the rejections the vaccine are getting from a lot of countries around the world. I travel a lot and my income is based on traveling. What do you guys suggest I do going forward?
That question looked very familiar. I think we actually got it and I responded. So the first thing is that persons need to understand that it's not that you are not allowed to enter a particular country because of your vaccination status. So you can travel to those countries. I think what you need to consider is the quarantine requirements. So, for example, if you're going to a particular country, I mean, countries are using the WHO list of approved vaccines, emergency approved, FDA approved vaccines to allow. Trinidad, Grenada, just to name a few of those places.
US, Canada.
You will be allowed to travel to the country, but you will be subjected to quarantine. For those persons who are have you been vaccinated more than 6 months? Are you willing to consider doing a booster shot with Pfizer that's available? Because since you're vaccinated with Sputnik, that's also an option that we could discuss with you as well. So I want people to understand you're not being banned from a particular country. You will be allowed to go into the country, but it's just that you will have to quarantine. You could also receive the other vaccine, which is the full dose of the Pfizer vaccine if the individual is actually interested once you've passed that 6 months mark. I see Crystal open her eyes. Yes.
Yeah.
It's possible.
Yes, because that is rather interesting. So that's 2 vaccines because a country, not because I want to be fully protected, but because the country does not allow a certain vaccine.
But it also offers you that protection. So you're not just doing it out of the fact that you want to get into the country. It's also going to offer you additional protection as well.
Oh boy.
So you could decide, you go into the country, but you will be subjected to the quarantine requirements of that specific country if they're only using WHO approved vaccines.
Okay, so let's get to some more questions. All right, can you ask Miss John to explain, or Mr. Elliott could explain it, to explain to the public what they should do when taking care of a COVID positive person?
So the first thing in terms of taking care of a COVID-19 positive, and I'm assuming that this is somebody who needs direct care, because for an unhealthy individual, isolation is key. Ideally, we would like them to isolate in a room where they may have their own bathroom, or if they're sharing bathroom, it should have minimal contact with any other person in the household. So sometimes we have persons who are in isolation who may isolate in another venue, another location, so that they would reduce the contact of that person. So isolation, the person can eat for themselves, move about for themselves, etc. If you are directly caring for somebody who is COVID-19 positive because they're physically challenged, mentally challenged, etc., it may be a case that you may actually need us from the Ministry of Health to give you some further assistance and guidance. But in the meantime, the precautionary measures are what is important. So wearing of the mask, wearing of protective, whether you want to say PPEs, the protective equipment over you. So you may use a gong, especially if you have direct contact, you need to probably try to bathe the person, etc. But all of these would have to be in the context of advice from the clinical team. So I would really advise those persons, if you're taking care directly, interacting with the individual, that you seek the advice from the team from the district level. You could call the polyclinics, ask to speak to the COVID-19 team and let them advise you specifically. But for regular healthy individual testing positive, isolate. If there's an area where you could set up a station outside the door where they may put their dishes, then you can collect their meals, make sure that they have adequate water. You check on them on a daily basis. You knock on the door. How you doing this morning? You good? Everything okay? Don't lock people away and then just leave them there. Checking in is still important. Video calling, WhatsApp messaging, make sure that they're fully equipped to go through that process.
Okay, and it'll be a little different if children, like if you have children. So really and truly, seek advice from the healthcare, especially babies.
If you have children, and you're the direct parents or the guardians, you're automatically in isolation as well. Because especially if you have children under 5. You cannot leave your child. You should not leave your child in a room by his or her own self. You really need to be with the child. So automatically you become exposed. But if you are not tested positive as yet because of the exposure, wear your mask, take all the necessary precautionary measures, and start to sanitize the area, especially those frequently touched areas where the children may dwell or the child may dwell, and to sort of limit exposure to other members in the household. Because we do have people who tested positive in the household, and because their interaction is not extremely high, other persons in the household are not tested positive. Whereas we have persons who test positive, and every two-man bagay in the house tests positive. So you really have to measure the interaction there.
Okay. All right. Elliot, this one is for you. Good morning. I'm concerned and confused here. Someone contract COVID-19 after recovering. That simply means your body would have developed antibodies to fight it off naturally. So is it necessary to take the vaccine still? If so, why? Because we all would have learned nothing is better than natural. So I'm thinking you don't need to. If I'm wrong, then explain why.
Now that's a question we tend to get a lot. If I get COVID-19 and I build antibodies to COVID-19, why do I need to take a vaccine? Now a lot of it has to do with the amount of variants of COVID-19 that we have out there, and the response that your body developed to that infection, to that strain of COVID-19 that you have acquired. I mean, we tend to go by evidence, and the evidence has shown us that persons who have had COVID-19 are still getting COVID-19 a second time. There are lots of repeat infections that we are seeing based on the data that is out there. Now, the vaccine offers you a broader immune response. And for persons who have had COVID-19, the data is showing that your immune response doesn't do so well at protecting you from repeat infection. So getting vaccinated really adds that boost to your immune system, that it offers you a better layer of protection. As to when you get that second vaccine, I know some countries are doing 2 weeks after your negative test, but I think here in St. Louis, we are giving you that option for vaccination at 3 months in after you have recovered from COVID-19.
Okay. So before you get your vaccine, as you mentioned that, right? Should you be tested for COVID-19?
Now, we have to look at how does testing offer you a benefit. So you are tested today for COVID-19 and you have received a vaccination shot today, but then you pick up COVID-19 2 days in. If you are tested for COVID-19, I do hold your opinion that health is a shared responsibility. And I mean, I've been bombarded with people who not only want to have a COVID-19 test done, but they also want to be tested for other things, underlying condition, comorbidities, and stuff like that. I think if you as an individual want to have a test done, you can get a test done prior to vaccination, but it's not going to be sustainable from the Ministry of Health perspective. And when we look at the benefit of getting you tested prior to vaccination, I mean, what we do when somebody come in for a vaccination is to take what is called a clinical history. And I think that's where our strength is, because that clinical history is going to reveal a lot of things to the vaccinator. If you have a predisposition for certain things, if you have had certain signs and symptoms, which is going to now render you a candidate for testing. And that sort of information is what we need to double down on in terms of collecting the clinical history, and not so much of doing testing for person, because it doesn't really add benefit to the process.
Okay. So somebody asks if you can break down really quickly, because we're quickly running out of time. If you can break down why people should get vaccinated.
Okay, so vaccination for me offers you a single benefit, and it's what I call preparing yourself for the inevitable. Now, I like to use two scenarios that I can reach out to persons. I try to keep it as unscientific as possible.
Yes.
Let's just say that there's somebody who's going around and that person is breaking into person's homes, right? And the police is saying to you that they want the public to install a surveillance system that you are able to do two things. You're able to recognize the burglar on entry, and you're able to respond. I mean, same thing that we're having now. One set of persons are saying, I don't want it in my home because the government wants to see what I have. They want to increase my taxes. They want to come and take my stuff. And the other set of persons are saying, listen, I want to have this surveillance system to offer me that level of protection. Now, let's look at both scenarios. When that burglar comes, for the persons who don't have that surveillance system, they are probably going to be caught sleeping, because that is what happens when you expose yourself to a COVID-19 infection. The infectious load you take on, those viruses are moving towards your cells, they're entering the cells, and they're sitting in your cells, taking over your cellular machinery to make more copies of themselves. And the body don't recognize their presence until 3 to 5 days in. When the virus is ready to launch an attack, it's very often too late for your immune system to respond. And you are going to have to run that course of disease, and nobody knows where on the spectrum of disease you're going to end up. Some people, 82% of persons have a mild infection, but you still have people who progress to what? Hospitalization and death. I mean, when you look at the data, Crystal, you're seeing that it took us about 22 months to lose 12 persons, and we have lost 4 persons. A quarter of the deaths we've had in 22 months, we have lost those persons in just about a month. So we are dealing with a variant of the virus that is more penetrable and definitely can do more harm. For the persons who are vaccinated, which equates to the persons who have taken that surveillance system, those persons are able to recognize the burglar on entry. And they are awakened in the middle of the night and they can respond. They may have a legal firearm, they may have a machete, they may have mace, and they can respond. I mean, if I translate that into reality, when you encounter a burglar, a struggle might ensue, and you may not fare so well against a burglar. And that is where you have a small percentage of people in reality who are vaccinated, who get COVID-19 and do not do well, because you don't know where on the spectrum of disease and the probability of outcome things are going to happen. But the crux of the idea is that vaccination offers you an ability to train your immune system to recognize the virus quickly, and that is where the rubber meets the road. The unvaccinated persons do not have that advantage. And we are seeing where hospital admissions for this novel strain of coronavirus, 97% of the persons are unvaccinated. I mean, WHO have now said that this pandemic is now a pandemic of the unvaccinated, and there's a reason why they said it. The vaccinated persons have a greater chance of fending off the disease, and if they actually are affected by it, they have a greater chance that it's not going to progress to hospitalization and death. And to me, that is worth all of the effort in terms of getting vaccinated. That makes all of the difference.
All right. So I want to touch on quickly as well. We have three different vaccines that are available to persons here: Pfizer, AstraZeneca, and the Sputnik. Based on what's been happening with Sputnik V across the entire globe, how do you reinforce or bring back people's confidence into Sputnik? You don't want it to come to a state where people are not taking Sputnik because of the travel or quarantine restrictions overseas. And you don't want it to come to a case where the Sputnik might just end up in wasting because something that we were paid for. How do you reinstall or reinforce that confidence in people in taking Sputnik?
Well, Shanika can feedback as well, but I just want to quickly say that one of the things that we do is to give people an option, and we tend to tell people, we tend to give you all of the concerns that may surround the particular vaccine product. So we have Pfizer, we have Sputnik, we have AstraZeneca, which is what we get from the Serum Institute of India. I mean, we have to be honest with people. Some people will tell you that I am really not concerned about traveling because I have no intent to travel, and I've heard that Sputnik performs very well, and I want to have the Sputnik. So there are persons who are not fazed by the fact that Sputnik is being rejected by the international community or not accepted. Then you have people who have their concerns about, they may have a predisposition for clotting, and they have concerns that they don't want to use AstraZeneca because AstraZeneca was, quote unquote, involved in a small group of persons who had a thrombolytic episode. But there are persons who will take a vaccine product based on many different reasons. So if somebody wants to travel, we have options for them. If somebody thinks that a Sputnik is the best choice for them, but we do give persons the information surrounding which vaccine product might be best for them and to allow them to make that choice.
All right.
That was part of the reason as well, Crystal, why we tried our best to have variety in country in St. Vincent and the Grenadines, so that persons could have the option of choosing which vaccine. And we do have more Pfizer vaccines that are supposed to come on stream. We expect them before the year is out. So we do have sufficient vaccines. If persons are concerned about taking the Sputnik or the AstraZeneca for travel purpose, we really direct them towards the Pfizer vaccine, of which we have sufficient for both our children 12 years and older, and for adults as well willing to take that vaccine. So as Elliott said, generally we have a discussion with persons. If travel is nowhere in your sight and you really have no concern with that, the options are available. The best vaccine is the vaccine that's available to you, but we narrow it down specifically based on your specific requests for why you're taking the vaccine as well.
All right. So we've had as well some concerns concerning businesses. All right. So there might be a little cluster at a business place, and the manager, they're not closing the business place. They're not telling staff what advice do you have for staff members, maybe the manager? What can they do if there's a known cluster within a business and the employees are still told to come to work? What advice you have for them?
Well, first of all, if there is a known cluster in any business place, our contact tracing team is already on it, and most likely that business would probably be closed for a day or two. When you say cluster, you're talking about a group of people within one particular setting, could be more than five as well, who
Mm-hmm.
tested positive. And the
Mm-hmm.
smaller the population of the workplace is, the more widespread the virus could be. So when you
Mm-hmm.
say cluster, I wanted to just be mindful versus having one individual testing positive. So cluster contact tracing team would immediately go in, and that business may very well be temporarily unavailable for a couple of days. In some instances, if there's sufficient staff, because you may have a cluster on one particular shift and the other shift was not exposed, depending on how your system is set up. So the
Right.
cluster of those persons would be immediately removed. The contact tracing team would go into it. For businesses, if you have one person testing positive, we really want you to first identify your primary contacts in the workplace. So people who share offices, people who share the same space, devices, etc. Bearing in mind that all the precautionary measures should be enforced in the workplace from since last year.
Mm-hmm.
Some persons will probably have slip off a bit here and there, but at this time, it's really important to reintroduce them and reinforce them as well going forward. So one person tests positive, you identify the primary contacts of those persons, primary contacts quarantine and to be tested at a later time. If the primary contacts rule out negative, we could safely move forward in terms of coursing. But if you continue to have positive after each, then we may definitely need to have an intervention in terms of mass testing in the house, depending on what the situation is. And of course, in those instances, we inform the entire management team, the entire staff is also aware. I think what we would not do from the Ministry of Health, and we've said this before, is that we will not give specific information about an individual to their supervisors or to their managers. It is still public health, it is still a health information. If there's need for us to concern that there's a specific issue that needs to be addressed, we will do that. But I think the onus is really on the individual themselves to alert their supervisor that they would be out for a period of time, which also should be supported by the sick leave as well. Or if you're in quarantine, also should be supported by the sick leave, in order for them to be able to go through that duration of the time.
All right. If the business is known to have, you said the cluster is about 5 persons, right? So if the business is known to have that cluster, and let's say they're trying to keep it on the hush hush, can employees report that business to the Ministry of Health?
Yes, definitely. We've had instances where that has happened. When I say happen, I mean we've had to investigate. Let me say that. We've had
Okay.
to investigate particular situations because people were reaching out to us. We saw some social media comments and some remarks, etc. And so the Ministry of Health, from our contact tracing team, depending on the district, we will definitely investigate the situation. And once we find that there's evidence that one staff has been compromised and there's potential exposure on the workplace, we will take the necessary action with the police force as well to ensure that the safety of those persons there and others are maintained.
All right. So somebody else has a question. If someone is tested positive, do they provide transportation for that positive person? Or do you go back home?
If you are tested positive, you go to one of our flu clinics and you have a positive antigen test because the
Mm-hmm.
PCR test may be waiting. So I'm assuming that this is a positive antigen test.
Right.
If you have a positive antigen test, we ask you to take the precautionary measures, wear your mask, sanitize, keep your distance, and head straight to your household. I know persons generally would want us to have allocated transportation. We have 9 health districts across St. Vincent and the Grenadines. We have roughly over 100 persons going to our flu clinics on a daily basis. Right at this particular time, we do not have the capacity to be able to transport in people on an individual basis back to their home. So outside of that, we've asked for other measures to be put in place, which is why we've asked for reduced numbers within our public transportation system that allows for physical distancing and minimize contact of individuals as well. We've asked persons to wear mandatory mask use in public spaces or where the public has access to. All of these measures are really to help to curtail any further spread in country.
All right. So another question coming in from a listener. Good morning, Crystal. Question to your panel. if you're not testing persons on arrival, oh boy, we're about there. Why do you still have to go to a hotel to quarantine for 48 hours? What measures are in place to know if a person is negative besides the PCR test that was presented on arrival?
So if we're not testing person on arrival, and I mean, I want to go back because when you had asked me about whether or not it was as a result of shortage of
Resources.
supplies, right?
Mhm.
I wanted to come back at it to say that if you can name a country in this region who do not have some implication towards their supplies, and it
Mhm.
doesn't even have to be PCR. We're talking about PPEs that all of us have to have access to. So these are things that we really have to try to consider as well. That is not unique to St. Vincent and the Grenadines, but it is something that is definitely happening globally. So if we're not testing, why do you still have to go to the hotel? Because we're clearing the flights. So if we're clearing the flight and we are testing persons on the flight, unvaccinated persons, and a few vaccinated persons, depending on your engagement in country, we may want to be able to detect whether or not there is any positive contact or multiple persons testing positive on that particular flight, where may then be an exposure flight. So part of the reason why we still want you to go into quarantine for that particular period as well. How do we know if somebody needs to be tested negative after they leave quarantine? We can facilitate the testing. I mean, there would be discussions as to where the testing would be, whether we would then do facilitate testing at hotels, or persons can go to their flu clinics, etc. And all of these things is what we're going to try to discuss as we go forward to, one, prepare us for more flights coming into St. Vincent and the Grenadines, and also trying to allocate our resources where it's needed mostly.
All right. So we're gonna take a call, and this will be the final input for this morning because
Okay.
and we lost our call. So sorry. All right. Okay, here it is. Hello. Good morning.
Hi, good morning.
Hi. What's up?
Not much.
All
Let
right.
me say good morning to your panel. And this is the kind of things that we welcome greatly. People have a lot of concern, and therefore, forums like this help people to get a lot of things cleared up. And I really commend the team from the ministry highly, and I wish they will continue this throughout the country. Having said that, Crystal,
Yes, please.
the suggestion I'm going to make now has to do with a question that somebody just posed, that you read out.
Mhm.
And it has to do with the persons when they get to the testing facility. Now, Shanika was just giving us some of the tips that you should do if you test positive, and so on at the
Mhm.
facility, you're going to home and so. What perhaps can be done is that a little information, some little information brochure, something be prepared so that while persons are waiting to be tested, there is information that they could read, because people sit around. I mean, it takes practically a day sometimes to get a test done.
Mhm.
Therefore, if they have things that they can read while they're there on the same vaccine, I think it should go and help in terms of the continued education and really trying to move people, get people's consciousness so fertile that they will now be moved to take the vaccine. All right? Thank you.
All right. Thank you so much for that contribution.
Thank you so much. And I think that's a fair contribution as well. We do have some brochures available. We're actually working with our flu clinics to ensure that they have adequate signage. And I think even coming out of the health promotion unit in the Ministry of Health, we're going to also try our best to see how we could facilitate some open discussions while people have that waiting period during the facility, all of which, of course, has to be done in a very safe way. Because we're getting persons who are symptomatic going to these places as well.
All right, boy. The constant they have done there, boy. All right, just a minute away from 10 o'clock. Your final thoughts, encouragement for people to do what is right, to follow the protocols. Final words.
So my final word would be for you. I want to thank you, Extreme Radio Station in particular, and other radio stations who have given us the opportunity. But you guys have been fairly willing and accommodating to us, unlike other radio stations.
Extremely.
To give
Say
us
extremely.
to give us an opportunity to have the discussion and to clear up some things and to have that one-on-one engagement. So I really want to thank you for that opportunity, one. And I really want to make a plead to all radio stations to give us that fair opportunity as well to have the discussion, and don't have the discussion without us. Include us in the discussion so that we could share some accurate information with you and we can update the public as well. So I really want to encourage persons to stay safe. And as usual, my tagline is really a good week to get vaccinated.
All right, Elliott.
So I want to begin. Well, two things I want to wrap up on. Vaccination. You know, I'm a big advocate for vaccines, and I do want to encourage the public. I mean, I've always been saying if you're eligible for exemption and you have not yet been vaccinated, we do encourage you to go out and get vaccinated today. The benefit is personal. It extrapolates onto your family, onto the community, and I mean, for St. Vincent and the Grenadines, it's really just the best thing to do. It's a social responsibility. It's a civic duty. So I do encourage you to get vaccinated. In terms of our testing supply, I do want to, in terms of our testing capacity, I do want to extend my understanding to the public about your concern. But I do want you to know that we're doing everything that we can as well to ensure that we do have supplies on island to offer you this very important service. We understand that laboratory underpins the response to COVID-19. As a matter of fact, we provide the information to the public health team to do exactly what they have to do to mitigate against this disease. And we are doing everything that we can to ensure that our services are up and running. And we are getting the support that we should get from the Ministry of Health. Thank you.
All right, not a problem. Thank you so much, Shanika. Thank you so much, Elliott, for taking the time out to join us this morning and to share a lot of the questions that a lot of listeners and perhaps non-listeners have been asking from time to time since this spike, since we've seen a steady increase of COVID-19 and positive cases here in SVG. Have yourself a wonderful day and stay safe. I can't tell you to get vaccinated because you're already vaccinated.
Thank you.
All right, you're welcome. Have a good one.
Bye-bye.